name is Dr. Carolyn Jack. I'm a dermatologist and immunologist, and I'm co-founder of EczemaQ. I'm the doctor of last resort for patients with atopic dermatitis, commonly known as eczema. EczemaQ, our software as a medical device, provides remote access to care, personalized medicine, and empowers patients with shared decision-making and self-management.
I'm the Director of Operation and co-founder of EczemaQ. Throughout my life, I've struggled with unbearable itch and intense flares of disease. In 2018, I was hospitalized at St. Mary's after presenting to the ER with infected open sores all over my body. I had spent weeks where I couldn't sleep, I couldn't shower, I couldn't focus on school. It felt like my skin was on fire. As a last resort, I was referred to Dr. Jack, and that encounter changed my life. And since then, we've been working closely together to develop a tool to help other patients like me, because I'm not alone suffering, and these patients also deserve support to manage their disease.
In fact, atopic dermatitis is the most common. It's the most burdensome skin disorder worldwide. It affects 5 to 10% of adults in developed countries. It comes with an astronomical cost, both to individuals and to healthcare systems, estimated at almost $4 billion in the United States annually. We know that cost is for individuals nearly doubled for patients who have uncontrolled disease. And so why is it so hard, and why is innovation needed? To start with, there's no diagnostic test. It's a completely unstable disease. It's constantly changing. It's unpredictable. It's variable in its distribution and time course. And it is something that can look differently in different populations. It's not just a skin disease. Patients suffer, they're stigmatized, and also it's an open door to further sensitization to allergies, food allergies, asthma, allergic rhinitis, hay fever. Patients and their skin are petri dishes with overgrowth of bacteria, leading to a lot of mental health disorder, anxiety, depression, and there's restricted access to dermatologists. We have the highest number of pending consultations. 52,000 patients actively waiting in Quebec is very real. And so someone like this may not get to see me for 6 months to a year, and when they do, a list of questions that I might have to go through with them is really quite long, and essentially this is just a section of it, because I'm trying to assess just how much of the disease they've had over their life course, what treatments they've failed, what kind of environmental triggers they may have in their environment, how I can modify them with them, how we can look at other triggers for the disease that can be avoided, and how it will change over time, and how when I need to assess the disease, I need to measure it, incorporating the entire body surface area with validated disease severity measures. I then need to intervene with a complex therapy for different parts of the body, and then that treatment will change over time as the disease does, and we try and optimize it. We may have to go through first, second, third, and fourth line treatments that change their immune system. I need to talk to them about all of those things and the modifiable factors and how I'm going to safely change their immune system with lots of monitoring. Patients end up lost. It's too much. They are left with questions because it all has to happen within 5 to 10 minutes. It's too complex and time consuming. This is really why the current standard of care has led to so much failure. This has led to a high number of patients turning to digital resources for self-management. Its current market is essentially being addressed by our solution, EczemaQ, a mobile health application that is a software acting as a medical device. We've done extensive studies and market analyses, and we know that the studies show that the majority of the existing apps out there don't comply with international guidelines. They haven't been co-developed with experts or with patients, and they really insufficiently support that evidence-based self-management of disease. Our tool is patient-guided. It answers patients' questions. It's expert-validated, and it features a staged consent model where you can log in as a guest, or you can personalize the tool and control the data yourself. And there's a third stage, which we had previously talked about. The content is optimized to answer patient questions in a choose-your-own-adventure multimedia method. And we have a body map that allows patients to know what treatments to use when and where. And this also is associated with a diagnostic assistant. So it's essentially an intake data form, and we can also track disease using validated disease severity measures. We can capture the disease with our photo tool and photo gallery, and it's bilingual. We know that this tool can really have a tremendous impact on the suffering worldwide, that it can actually change the treatment landscape, and we will reduce the burden of in-person knowledge translation currently, gaining in efficiency for both clinicians and patients. It allows for that remote access to care and to disease measurement and capture, and this will lead to long-term reductions in costs. We have an REB-approved study already underway, iterating with healthcare providers and patients with a co-development model, followed by a public launch. And then we follow that with an RCT where we're validating efficacy versus the current standard of care. We know this will let us through the regulatory landscape that is necessary to be licensed by Health Canada as a software as medical device. And our extensive network will allow us to optimize and maintain this model over time. We really want to make this innovative tool freely available to patients and clinicians in the wider public.